The advertising messages in this episode are paid for by clonoSEQ. Minimal residual disease, or MRD, and IGHV mutation status are both clinically relevant prognostic indicators for patients with CLL. Learn about clonoSEQ, a next-generation sequencing option to test for both at cllprognosis.com. You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS member Diane Cope, Director of Nursing and Oncology Nurse Practitioner at Florida Cancer Specialist and Research Institute in Fort Myers, to discuss tumor lysis syndrome, which we'll call TLS from now on, and its current prevention and management strategies. This episode is part of a series about oncologic emergencies. The previous episodes are linked in the episode notes. The advertising messages in this episode are paid for by clonoSEQ. Thanks for joining me today, Diane.
Thank you for having me.
So we're going to talk about TLS, which is something that oncology nurses pretty much are going to see in their practice at some point. So can you give us some background on what that really is?
TLS is a condition that occurs when a large number of cancer cells die within a short period of time, releasing their contents into the blood. It is considered an oncologic emergency. It is classified as a most common oncologic emergency, and it's due to the rapid breakdown of malignant cells causing electrolyte disturbances, which include hyperuricemia, hyperkalemia, hyperphosphatemia, hypocalcemia, and thus cause very serious clinical consequences such as acute renal injury, cardiac arrhythmias, hypotension, and can also lead to death.
So Diane, can you tell us, are there certain patient populations that might be at a greater risk for developing TLS?
Yes, and that's one of the key points that is really important for nurses to really hone in on in their patient care. It's patients with a large tumor burden of cancer cells and are tumors that typically have rapidly dividing cells, such as acute leukemia, high-grade lymphoma, tumors that are very highly responsive to therapy. These are the patients that are at greatest risk of developing tumor lysis syndrome. And it's not only those patients that are on chemotherapy, but TLS can also happen when patients are on steroidal therapy, hormonal therapy, targeted therapy, or radiation therapy. In addition, there are cases where there is spontaneous TLS. And this happens usually with the more rapidly proliferating high-grade hematologic malignancies, maybe those that are having an extremely high white count, others such as Burkitt's lymphoma, acute myeloid leukemia, anaplastic large T-cell, or diffuse large B-cell lymphoma. Patients' factors, if they present, can also make them more at risk for TLS. Patients who come in dehydrated, those who already have existing kidney dysfunction, because the kidneys are so important that when this rapid breakdown of cells happens, that they get adequately excreted. So those are the individuals that are really at higher risk of developing TLS, and that's something nursing can really hone in on, trying to identify those patients kind of as a preventative type measure.
So those are patients that probably all oncology nurses are going to see at one point or another in their career.
Yes.
With that, I feel like as an oncology nurse, there are so many things that we have to know and remember, and we're constantly learning and, learning about new treatments and things like that. And then, you add on things like Emergencies and, with something like TLS, and it's just another added kind of piece of that puzzle that it's so important that we know and understand, because as you said, these patients, if we're not keeping an eye on that or aware of that, can have one of these episodes pretty quickly and make a really sharp turn in a bad direction.
Yes, that's correct. And also, what's rather complex about this is that when they present, some of their symptoms can be definitely non-specific. It can include nausea with or without vomiting, which people on treatment can have. Lack of appetite and fatigue, again, another symptom that's kind of treatment related. They also have dark urine, reduced urine output, or flank pain. They also have neuromuscular and cardiovascular presentation where they have numbness, seizures, or hallucinations in the very late stages of TLS if left untreated. They can have muscle cramps and spasms, which is very characteristic because of the electrolyte disturbances. And then also heart palpitations because of the electrolyte disturbances, specifically the hypocalcemia.
Diane, one of the things that you were mentioning was just about all of these side effects. And these are all things that patients could come in with that are non-specific to TLS. And with all of our oncology patients, every symptom that they have could be a side effect of treatment or of an onc-emergency, like we're talking about. So if a nurse is trying to understand this better, what are some of the preventative strategies that they can be aware of for TLS?
They should definitely be educated about a patient who has a high risk for developing TLS. That will kind of clue them in to taking more caution and following with blood lab results and potential symptoms that are mimicking TLS. Another strategy is that the patient should have been put on allopurinol. It's an oral drug, usually administered pre-treatment. It can start 2 to 5 days prior to treatment and then should last for approximately 5 days after the treatment, and that's to take care of that hyperuricemia. Allopurinol treats preventatively. It does not lower existing hyperuricemia. IV hydration is also important as a preventative strategy. Patients may be scheduled to come in for any admission on a high dose type of treatment for cancers that are high risk of TLS, and they should be hydrated at least 1 to 2 days prior to the initiation of any type of treatment. Another drug that is available is rasburicase. Rasburicase is an IV drug. It can be used for both preventative and also to treat hyperuricemia. If that drug is used instead of allopurinol, if the patient can't take oral drug, rasburicase is IV, and it is usually administered 4 to 24 hours prior to the initiation of chemotherapy. In giving some of the fluid hydration, it is important to also make sure that the patient is not becoming fluid overload. And oftentimes the patient will be placed on a loop diuretic to make sure that they're having adequate urine output. So those are several things that are done preventatively for TLS.
And you've talked about several of the medications that are used in prevention and also in management almost, with the IV fluids. And Are there any other types of treatment options or management things that nurses need to understand, or are there any other specific nursing considerations for when dealing with a patient who is experiencing TLS?
After rasburicase, which is quite effective in lowering the uric acid, there's also treatment strategies that are just focused on treating the electrolyte disturbances. That being hyperkalemia, any medications to lower the potassium. What is also important as a preventative type measure in a nursing role is to make sure that the patient is doing a low potassium and low phosphorus diet and reviewing foods that are low in potassium and phosphorus. Also, in the treatment setting arena is medications to lower phosphorus and also then calcium IV supplementation. So they're all really a supportive type measure. In worst case scenarios, the patient may actually have to go on dialysis if kidney failure is a result or a presenting symptom.
All of these side effects that you're talking about, or symptoms that you're talking about with TLS, are just such scary things, not only for us as nurses, and because it is an emergency type situation, but also for our patients whenever we're trying to explain to them what the side effect management might be, or what kinds of things could be side effects of their treatment. And then you throw this in there and, it's another piece that kind of makes them anxious about everything. And we don't want to do that, but we want to make them aware so that they can notify us if they start having any symptoms, because so many of these patients are being treated, on an outpatient basis now. And it's so important for them to understand what kinds of things they need to report back to the nurse and let them know what is going on.
Definitely. There's many nursing moments here. Much education, both for the patient and caregiver, making sure that they have the allopurinol if it is prescribed, making sure that they understand when they should be taking it, starting that before they actually get any type of treatment, getting the caregiver involved in those measures, reviewing the diet is very important, and also that if it is on an outpatient basis, that they are staying well hydrated, or if they do need to come in for hydration, and explaining the rationale for those preventative measures.
Yeah. In all of our episodes about Onc-Emergencies, I can't stress enough how important that patient and family caregiver education is, to be aware and just to let them know that it's okay to contact us. I feel, like the patients and family members don't want to bother the healthcare team, and just having that rapport with them to let them know that that's okay. They're not bothering us. This is really important for them to let us know.
I definitely do that in practice. I've had many mishaps of patients stating, "We didn't want to bother you. Well, we just wanted to see if by tomorrow it would go away." And I basically tell patients and caregivers, contact us. Let us be the ones to kind of decipher things. We'll let you know, okay, this is normal or this is not normal, and this is what we need to act on.
Right. It's so very important. So we've talked about a lot of the prevention strategies, the treatment strategies when you do have a patient that is experiencing TLS, and several of the nursing considerations that you've talked about. But let's talk a little bit about the workup process. So what would happen if a nurse is suspecting a patient with TLS?
Workup process is focused on both the lab work and any presenting symptoms. But the lab work is going to be key in really identifying those patients. And the two really big takeaways that I feel for nursing are knowing if a patient is at risk, so you can be on alert, and also following that lab result to kind of look for any of these high potassium, high phosphorus, high uric acid, and low calcium. And taking a step back and really thinking and putting all those pieces together so that the patient can quickly get some sort of treatment. Also, the BUN and creatinine, following that kidney function is very critical. I've seen patients, unfortunately, who were not pre-treated prophylactically, who were felt to be, maybe at low risk, but they came in and unfortunately they were already in renal failure and had to immediately get started on dialysis in the hospital setting. Nursing should also be, aware of these labs, and even if they do get the preventative treatment, the hydration, they need to follow that lab work closely. In the hospital setting, if the patient comes in very critical, they may be following up on these labs every 4 to 6 hours. In the outpatient, it may be daily labs, but those are definitely things that they need to note and immediately bring attention to the provider.
Yeah, I think it's so important to understand the labs, like you're saying. You talked about some of the other symptoms that they may have, with the nausea and maybe some cardiac symptoms and things like that. But, like you just mentioned, the lab work is so vital for this onc emergency. And those things can change so quickly. And another thing you mentioned earlier also was just that almost every type of treatment that an oncology patient can receive has the potential of having a patient go into a TLS emergency. So it's not necessarily just one treatment option that we need to worry about patients on this specific treatment, but it could happen with any of them and how it affects the tumor burden. And I think that's just another thing that's really important for us to remember.
Definitely. Usually with chemotherapy, it's in that close window of a few days that this can occur. But yes, definitely need to be on high alert with possibly radiation, surgery, and we want to kill all those cells, but it has to be done in a very safe and close follow-up manner.
The advertising messages in this episode are paid for by clonoSEQ. CLL guidelines recommend testing for IGHV mutation to stratify risk and MRD for continuous disease monitoring. Get both results from one assay, clonoSEQ. Learn more at cllprognosis.com. Available by prescription use only. For more important info about the FDA-cleared uses of clonoSEQ, including sample types and test limitations, visit clonoSEQ.com/technical-summary. IGHV testing is available as a CLIA validated LDT and is not FDA cleared or approved. So when you are working a patient up and, you start seeing all of these signs that are leading to a potential TLS emergency, what would make you believe that the patient would need a higher level of care, like ICU care?
Definitely with renal failure, if that is kind of climbing over several days or hopefully 1 to 2 days, you act on that. The hyperkalemia, they can also go into more severe problems with seizures and cardiac arrhythmias. So oftentimes EKGs, daily EKGs, just keeping a close eye on cardiac function. Any alterations in those would definitely indicate the patient really needs to be in ICU with close monitoring.
I remember a patient who was a CLL patient and was receiving treatment and did not get started on allopurinol and ended up in tumor lysis syndrome and was at home had to end up calling an ambulance to, transport the patient to the hospital because he wasn't able to stand up because he had no feeling in his legs and couldn't, he had fallen a couple of times at home because his legs were numb, ended up having to be in the ICU and on dialysis, and that was so scary for that patient and family. And I can remember thinking, and this was quite a while ago, but thinking that, if the patient would have been on allopurinol, they might not have been in that situation. And just how important it is, that we know, like you said, what those preventative measures are, that we can help prevent something that might get to that level of severity with these patients.
Very true. That's a great example of CLL. Most likely that patient may have been started on an oral agent. So these individuals are at home. We may all be focused on how are they tolerating that oral agent, but these hematologic malignancies definitely can have TLS. So it's quite very important to make sure that you're doing those lab monitorings on a frequent basis, especially if they're presenting with an extremely high white count.
Exactly. So, does your institution have nurse-driven protocols for managing TLS, with their patients, or is this something that is handled in a different way?
Being outpatient and being a very large practice with many different locations across the state of Florida, we do not have nurse-driven protocols. It is more physician preference on treatment of TLS. That being said, the nurse still plays a very key role in the teamwork and making sure that this lab work is brought to the provider so that they can definitely provide orders on how to treat that abnormal lab.
Thank you. I think it's so important for us to recognize that whole team approach and realize how important your role is in that team to make sure that all the pieces of that patient puzzle are being, looked at and reviewed and managed in an appropriate way to make sure that those patients have the best outcome that they can.
Definitely.
I wanted to ask you, are there any gero-oncology considerations for TLS that might be different, from other patient populations?
Yes. Gero-oncology is definitely prevalence because one of the most highest risk factors of a diagnosis of cancer is older age. That being said, the older population may bring a lot of comorbidities, which could alter kidney function, heart function at that point. So it's very important to make sure that you're following these individuals probably more closely than a younger TLS patient. It's important if you're giving hydration to make sure that their kidney function is very adequate, that they are excreting, having a good urine output. And these are individuals that may move more rapidly into fluid overload. So they do need to be monitored quite closely as opposed to some of the younger individuals with TLS or potential for TLS. And further with the older population is education. These medications are very critical that they're taking. What is actually going on in the home? Do they live alone? Are they able to see? Can they take the medications at the right time? That taking the allopurinol is so critical in that prevention strategy. So there's many other things. Do they have prescription coverage? Who's maybe checking in on them? What is their vision and hearing status? Those are all things that are so critical in putting this all together and making sure that they get the adequate care preventatively.
Yeah, those are some really good points. And like you said, even about the prescription coverage, I was thinking earlier just about, wondering what the cost of allopurinol may be. And it may be minimal, but in the grand scheme of what our patients' financial burden is with their treatment, us being able to make sure that those patients are getting that medication and, understand the importance of having that and, making sure that that is something that they can they afford to get that as part of their treatment, and knowing that we need to make sure that that's happening. Like you said, do they have the coverage for it? Are they taking it? And that doesn't just apply to our gero-oncology group, but for any of our patient population. And, just really trying to make sure we're considering all of those factors in their treatment, and with something that is so important to be a preventative measure for such a extreme emergency that they might have as a result of their treatment and their diagnosis.
Definitely.
So you talked a little bit earlier about the education that oncology nurses need to give to their patients and family members. Is there anything else that you would like to add to that, or can you just kind of recap for us again? What are those important points that we need to get across to our patients and their caregivers?
Some of the really important points are the rationale of why we are doing things. Why are we making you start medication beforehand? Why are we making you start IV hydration or, increasing oral hydration? Letting us know, about your urine output, monitoring your diet. I think if you can give them a rationale for all of this, it helps to get them on board with what their treatment could impact and the severity of this if it's not handled appropriately preventatively. There is also a great patient information page by JAMA Oncology. If individuals Google it, it's a one-page, nice patient education that really talks about what TLS is, why it is important to take the medications, what they should expect, and symptoms that they should call if they occur to the provider for notification. And it's always good to have things both in verbal and written manner so that they can take that home, have in hand, and if they have any questions, refer to that, or definitely be calling back to clinic or provider for care.
Such an important piece of our work with our patients and caregivers is that education. So we're coming to the end of our podcast, and there's just a few questions that I like to finish up with on each podcast that I want to ask you quickly. And the first one is, what's something about TLS that's not often discussed, but you wish people knew more about?
With any of the oncologic emergencies, we hope they don't happen. And in the large scheme of all the patients that we care for, it's not really a daily event. But this is something with any of the oncologic emergencies, especially TLS, that we should always have on our radar. This is a possibility. And so that education for nursing is really key to understand TLS and understand the preventative strategies, because this can be prevented. And if left untreated, these patients get severely ill and can progress quickly to a life-threatening situation.
Next, is there additional training or education that oncology nurses need to manage and treat TLS?
There isn't any additional training. I think that's all incorporated in understanding oncology. ONS has great webinars on just your basic oncology information, administration of chemotherapy, immunotherapy, and understanding all of those side effects. So to be really a well-rounded oncology nurse, this is information, education, knowledge that should be incorporated into daily nursing oncology practice.
And last, are there any additional resources? You mentioned the one for the patient education sheet, but any other ones for patient or providers who would like to learn more about TLS?
There's many, many resources for providers that are available. It's a topic that has ongoing research, but for the most part, those basic critical knowledge, information, factors that are similar with all TLS as far as what makes a high-risk patient, what are patient factors that you need to consider, what are those basic lab studies. So ONS has the Oncologic Emergency textbook, which has been great in providing very detail about TLS. There's other sources such as UpToDate, Medscape. Anywhere you want to Google, you can definitely find those basic key sources that have information about TLS.
Diane, thank you so much for joining me today to help oncology nurses understand TLS a little bit more and the importance of what we need to know to make sure that our patients are given safe and effective and care that is going to help them get the best outcome from their treatment. Do you have any final comments for us?
I just want to make sure that really it is a preventative type situation and very key to be on high alert for these patients to try and prevent those very serious consequences and life-threatening situations with these patients. And thank you for having me today.
The advertising messages in this episode were paid for by clonoSEQ. Join leading cancer centers and use clonoSEQ to test for IGHV mutation status and monitor MRD, covered by Medicare and many private insurers. Support may also be available for out-of-pocket costs. Learn more at cllprognosis.com. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.